Good morning. Welcome back to Nest 238, Classification and Management of Mental Disorders. We are going to look at anxiety and all the anxiety disorders in this session. I think we have 2 sessions for anxiety disorders. So, anxiety is a normal and adaptive response which prepares an individual to take on tasks that require extra effort, for example, prior to interviews, examinations, and appointments, meeting one's lover for the first time, and admission to hospital, etc. In all these situations, one experiences some level of anxiety that keeps one alert or awake, a little keyed up to be able to face the impending danger more appropriately. Before we proceed, I just want us to look at a few concepts. The concept of fear, conflict, frustration, and stress. Stress is the wear and tear that life causes on the body. It occurs while a person has difficulty dealing with life situations, problems, and goals. Examples: for many people, new public speaking is scary, but for teachers and actors, it is an everyday enjoyable experience. Marriage, childbirth, airplane, a new job, a new school, and leaving home are examples of stress-causing events. Fear is the emotional response to a consciously recognized and usually external threat to danger. Example of fear is fear of snake. And our conflict is a feeling of discomfort as a result of competition between 2 goals of similar importance. Frustration, on the other hand, occurs where there is a barrier between a person and his goal. Although anxiety is a normal phenomenon, yet in most cases, anxiety gets out of control by the person and becomes morbid. By morbid, we say it enters into a disease state. Anxiety state or morbid anxiety. This is a condition in which a patient shows prolonged and exaggerated or excessive anxiety with physiological changes. The condition appears inappropriate to the situation or excessive in degree. It is a maladaptive response, serves no useful purpose, and is the commonest mental illness that can occur. It occurs in all ages: childhood, adolescent, adult life, or old age in any degree or severity. Women are more apt to have anxiety reactions than men. They have anxieties about menstruation, pregnancy, menopause, etc. What are the causes of anxiety? Let's look at the biological causes. Gamma-aminobutyric acid is the amino acid or neurotransmitter believed to be dysfunctional in anxiety disorders. Insel 1986 has proposed that anxiety state occurs as a result of malfunctioning of the neurotransmitter gamma-aminobutyric acid. This could be an agent factor. Behavioral theory. The behavioral theorists view anxiety as being learned through experiences. Conversely, people can change or unlearn behaviors through new experiences. Behaviorists contend that disturbing behaviors that develop and interfere with a person's life can be extinguished or unlearned by repeated experiences guided by trained therapy. So the behaviorist is saying that anxiety is learned. And if it is learned, then it can be unlearned. You can be helped to unlearn it. The interpersonal theory. Harrison Stack Sullivan viewed anxiety as being generated from problems in interpersonal relationships. Caregivers can communicate anxiety to infants or children through inadequate nurturing, agitation when holding or handling the child, and distorted messages. He stressed the relation of the genesis of anxiety to the emotional bond between mother and child, especially until the child is 27 months old. The anxiety of the mother is transferred to the child. The psychoanalytic theory. Sigmund Freud viewed a person's innate anxiety as a stimulus for behavior, otherwise views anxiety as a defense against the anxiety experienced by the ego, as it mediates between the id impulses and those of the superego. Unfortunately, too much of the defense mechanisms also inhibits emotional growth and leads to poor problem solving. The genetic theory, anxiety may have an inherited component because first-degree relatives of clients with increased anxiety have a higher rate of developing anxiety, but this idea is largely inconclusive. Precipitating factors, mainly environmental. Anxiety disorders may be caused by the following conditions, especially where they persist. These are actual or potential threats to self-concept. Examples are threat of being referred in an exam. Value systems, ideals or beliefs. Example, the nurse whose religion forbids abortion may experience severe anxiety when the operation is being performed. Personal security system, loss of affection from spouse, possibility of being burgled, etc. Stability of the environment, threats of civil war, earthquake, etc. In recent times, we had this Hurricane Matthew in Haiti, and these are examples of the stability of the environment. Then we have role function, example, losing an election and being demoted to a junior rank or being promoted to a higher or more demanding positions. Other precipitating causes include changing from adolescence to adulthood, situational crisis, sudden bereavement, etc. The personality of anybody suffering from anxiety is called the anxious person. Generally, they are timid, they are uncertain, there is apprehension, they are easily embarrassed and afraid of others. Now we have levels of anxiety. The first one I want to look at is mild anxiety. And mild anxiety is a sensation that something different warrants special attention. Sensory stimulation increases and helps the person focus attention to learn, solve problems, think, act, feel, and protect himself. Mild anxiety often motivates people to make changes or to engage in goal-directed activities. Example, it helps students to focus on studying for an exam. Then we have moderate anxiety. It is the disturbing feeling that something is definitely wrong. The person becomes nervous or agitated. The person can still process information, solve problems, and learn new things with assistance from others. He finds it difficult to concentrate, but can be redirected to the topic. Example, the nurse might be giving pre-operative instructions to a client who is anxious about the upcoming surgical procedure. As the nurse is teaching, the client's attention wanders, but the nurse can regain the client's attention and direct him or her back to the task at hand. Severe anxiety. A person with severe anxiety has trouble thinking and reasoning. Muscles tighten and vital signs increase. The person paces, is restless, irritable, and angry. The next level is panic. In panic, the emotional psychomotor realm predominates with accompanying fight, flight, or freeze responses. Adrenaline surge greatly increases vital signs. The pupils enlarge to let in more light, and the only cognitive process focuses on the person's defense. We now want to look at the types of anxieties that we have. We have generalized anxiety disorder, we have phobic reactions, we have panic attacks, we have post-traumatic stress disorder, and we have obsessive-compulsive disorder. So let's look at these ones one after the other. The first one I want to look at is phobia or phobic reactions. Phobic reaction is an irrational fear of an object, activity, or situation that is out of proportion to the stimulus and result in avoidance of the object or situation. The avoidance of the object or situation relieves the individual of anxiety. Phobias are the most common form of anxiety disorders. These are some types of phobic reactions or types of phobias. We have acrophobia, that is fear of height. We have agoraphobia, fear of open spaces. We have grecophobia, is fear of home. We have ophidophobia, that is fear of snakes. We have thanatophobia, is fear of heat. Simple phobia, this is indicated when an individual shows persistent, irrational fear and avoidance of a particular object or situation. And social phobia is compelling desire to avoid situations in which one is exposed to the scrutiny of others. This fear is much stronger than normal anxiety, and most people experience. It is so strong that one has to avoid the situation altogether. Examples are fear of speaking in public, writing or signing documents in front of others, performing practicals, eating in public places, such persons are likely to abuse alcohol or drug as a means of decreasing the anxiety. How do we manage phobias? Desensitization, flooding, implosion, or we give drugs such as the benzodiazepines. The next type of anxiety we want to look at is panic attacks. This is characterized by unpredictable and acute attack of anxiety that is not specific to a particular object or situation. They are not caused by any medical problem or substance abuse and are followed by a period of distress. What are the symptoms of panic attack? There is intense fear, discomfort, dyspnea or shortness of breath, palpitation or pounding heart, choking sensation, there's dizziness, there's sweating, shaking or trembling, chest pain, fear of dying, chills, paresthesis or numbness or tingling sensations. These symptoms develop abruptly and reach a peak within 10 minutes and may last up to 1 hour. At least 4 of these symptoms are present in a full-blown panic attack. How do we manage panic attack? Give antidepressants if depression is present, give benzodiazepines, or give tricyclic antidepressants, or do a relaxation therapy. These are the references that you need to look at to read more about panic attacks.